Hello and welcome to EUFOREA TV Breaking News. My name is Dr. David Bull. I'm a medical journalist and I'm delighted to be back here again as your host for this, our first show of December 2020. This show is all about the American Rhinologic Society. In a minute, I'll be talking to Professors Joseph Hahn and Robert Kern about the Society, its aims, aspirations, and its challenges. Now, the American Rhinologic Society was founded in 1954 by a gentleman called Maurice Cottle. Initially, it focused on the evaluation and treatment of problems related to the nasal septum and external bony pyramid, but soon it evolved to include the evaluation and management of paranasal sinus problems. Now, not only did Dr. Cottle found the ARS, he was also instrumental in the founding of two other bodies, the European Rhinologic Society and the International Rhinological Society. Over the last 60 years, the membership has grown dramatically and the remit is constantly changing. Well, to tell us more about the work of this society, we now head to the state of Virginia in the USA, where we're joined by Professor Joseph Hahn, President of the ARS. He is also head of rhinology and endoscopic sinus and skull-base surgery at the Eastern Virginia Medical School. He is also the head of the allergy department there. Joseph, it is so good of you to join us here. Let me start by just saying, look, it's been an extraordinary 60 plus years for the society, and it's constantly evolving, it's constantly changing. But I suppose the question for me is, what do you see is the ambition and the vision for ARS in 2021?
So, as the president of the American Rhinologic Society, I've had the privilege to be able to shape the society. But it's been many years in the making. There are three things that I really want to try to achieve. One is patient-oriented care for the management of sinusitis. And so it's been a team approach. Even though these are objectives that I would like to see within the society, it's been a team approach in trying to achieve this goal. So one was creating a shared decision-making process or a tool for management of chronic sinusitis with nasal polyps. So that's something that we were just able to recently accomplish. We've been working with our development team on creating a patient-oriented website for management of sinusitis, because that's something that's currently lacking and is certainly in need for at this time. So we've been able to do that. We've been working on we've been working with other organizations and companies, and even within our own society to create patient-oriented care for the management of sinusitis. Another one that's been really important for me is education. I think that's probably the strength of the American Rhinologic Society, is strong evidence-based scientific education. And the last one is international outreach. I mean, that's something that I think is very important for us. Because right now, I think we're a very strong national society among otolaryngologists. I think that we can do better in having better outreach to other rhinologic societies throughout the world.
Well, you talk there very much about putting the patient at the center of care, and you also talk very passionately about education. So tell me, how is the ARS dealing with the current COVID pandemic?
So one of the things that the American Rhinologic Society has done is partner with the American Academy of Otolaryngology Head and Neck Surgery. So together, what we did was created an outline of evidence-based instructions and guidance for our otolaryngology members and our ENT society. Because of all the different subspecialty or specialty in the U.S., the one that's been affected the most is otolaryngology and rhinology. Partly because the coronavirus or COVID-19 is very high in the nasal and the sinus cavity. And so because of that, we try to create safety guidelines so that we can protect the patients, protect our employees, and also protect the providers.
Well, I noticed the ARS has actually installed a diversity officer. So how do you expect to benefit that position for the organisation?
David, you are very well informed. I am surprised how well informed you are. Diversity is very important for us because what diversity does is it brings people from different backgrounds, different perspectives. And when there's an issue, these individuals provide diversity of thought and basically are able to evaluate a situation through different perspective and basically come up with a solution that I think is the best. And so it's really out of self-interest that we created a diversity community so that we can have a more open and more comprehensive view on topics and issues.
Well, it sounds very forward-thinking indeed, and I wish you a great deal of success with it. Thank you very much indeed for talking to me, Professor Han.
Thank you, David. It's my pleasure.
Now, from Virginia, we head to Chicago, where I'm delighted to be joined by Professor Robert Kern. He is immediate past president of ARS and also head of otolaryngology, head and neck surgery at the Feinberg School of Medicine. It is wonderful to see you. Thank you for taking the time. I've just been speaking to Professor Hans about the ambition and vision for ARS next year, and we also talked about the current COVID pandemic. So perhaps I could ask you, where do you see the biggest challenges in the field of rhinology?
Well, the biggest issues going forward, probably the biggest issue, is how to incorporate these new, really spectacular medications that are coming available for sinusitis. For years, we've had corticosteroids and antibiotics and surgery. And there's been a few other minor medications out there, but those are the three basic treatment options. Well, now we sit on the dawn of an era when these biological agents, immunoglobulins that target specific aspects of the immune system in the nose, that's active in the nose, we have these, one available now, but there will be more available in the coming 2 to 3 years. And the question will be, how do we handle them? Who gets these drugs? How long are they treated? How do we relate them to the other treatments that we've used for years? How to do this in a cost-effective manner? And really, it's a fascinating time to be in otolaryngology because we sit on the edge of dawn of personalized medicine. These are areas that have been approached in cancer and in other diseases, but in sinusitis, we've been a little bit behind. I guess that's not surprising because people rarely die of sinusitis, but certainly they suffer.
Well, you talk extremely eloquently there about the dawn of personalised medicine. Do you think there's going to be one really important scientific breakthrough, or do you think it's going to be, as you've sort of outlined, a myriad of things that are coming onto the market, the way that clinicians use them, the fact that different treatments will work differently in different patients?
Well, from a scientific standpoint, I think I'm a bit biased here. I think that the answer is going to be in the mucus. Looking at a simple, non-invasive way that we're going to be able to, we can't now, but ultimately we're going to be able to separate out these patients. I think in the future, we're going to be much more molecular, scientific, whatever fancy word you want to use.
I mean, that truly is going to be extraordinary in terms of clinical care. What do you think, or how do you think patients will benefit? Because clearly there will be no longer this sort of broad brush approach. So patients are obviously going to be separated, as you say. You're going to very much go down that personalised medicine route. But clearly the outcomes have to be all about how the patients do.
Well, absolutely. This is a quality of life disease. This is not Alzheimer's. It's not cancer, but nevertheless, it's extremely expensive, and it's both the treatment of it as well as the negative effects of it. Their work performance. The studies are very clear that this is such a common problem that it's a huge drag on an economy. When I was a young surgeon, we used to give patients 6 weeks of antibiotics. And they rarely made a difference. The antibiotics work a little bit in my mind, but they certainly we don't give them anywhere near as frequently as we did then. But antibiotics are still overused for sinusitis. And that has a tremendous negative effect, not only on the patient, because it's changing his microbiome, and it's giving him all sorts of other side effects. It's killing a bunch of bacteria that are actually helpful to that patient, but it's changing the resistance patterns in a society as a whole. So then when somebody gets a pneumonia, it tends to be a resistant pneumonia because the biology of your whole microbial, or the nature of your whole microbial ecosystem in a particular region is changed. And this is a problem. It's particularly a big problem in the US, a little bit less in Europe, but in both places, antibiotic overuse, eliminating that, having specific treatments for the disease will go a long way to keeping us out of those blind alleys and reducing antibiotic resistance and decreasing the cost of healthcare as a whole, in my mind.
Well, the future sounds very bright indeed. Professor Kern, it's been an absolute pleasure to talk to you. Thank you very much indeed for your time.
Thank you.
Well, there you have it. We've heard all about the sterling work of the American Rhinologic Society over the last 60 plus years, and we wish them well for the next 60. Now, you can find more information about the subjects we cover on all of these shows on the EUFOREA.eu website, where you can also sign up to receive the latest news via email. You can also follow us on Twitter. Our address is @EUFOREA. But that is it for this episode. See you soon, and thank you for watching.